Hi, my name is Khushi Panchal, and this is my fifth project on post-surgical rehab of a craniectomy for Sports Medicine 3. Table of contents. This is a list of what I will be going over in this project. 1. What is a craniectomy? 2. Reasons for a craniectomy. 3. Risks of a craniectomy. 4. Steps of a craniectomy. 5. After the procedure at the hospital. 6. After the procedure at home. 7. Phases of rehab. And 8. A summary. So what is a craniectomy? A craniectomy is also known as a decompressive craniectomy, which is a neurosurgical procedure in which part of the skull is removed to allow a swelling brain to have room without being squeezed. Reason for a craniectomy. There are many reasons as to why a person needs to have a craniectomy. It is performed on victims of traumatic brain injury, stroke, and other conditions associated with raised intracranial pressure. Other reasons can be a tumor, aneurysm, infection, bleeding inside the skull, blood clot, skull fracture, dura tear, or epilepsy. Risks of a craniotomy. There are risks with every surgical procedure, however, risk with a neurosurgical procedure will increase. There is a higher risk of infection or bleeding in the brain, blood clots, pneumonia, unstable blood pressure, seizures, or muscle weakness. More swelling in the brain due to surgery and leakage of cerebrospinal fluid. Difficulty remembering things or difficulty with speech, paralysis, and abnormal balance or coordination. There is also a higher chance of the patient falling into a coma. Steps of a craniectomy. Step 1. The patient will be asked to remove any jewelry or other objects that will interfere with the procedure and will be asked to wear a gown. An intravenous or IV line will be inserted into our arm and a urinary catheter will be inserted to drain urine. Step 2. The patient will be positioned on the operating table and an anesthesiologist will monitor the patient's vitals. The head will be shaved and the incision site will be cleaned. During the procedure, the patient's head will be held in place with a device and the scalp will be pulled back to control bleeding and allow access to the brain. Step 3. A drill will be used to make boreholes into the skull and the bone flap will be removed and saved. The dura mater will be separated and cut from the bone to provide access to the brain. Tissue samples may be taken and sent to be tested and excess fluid may be drained. A device may be placed into the brain. Step 4. The surgeon will suture the layers of tissue together and the scalp incision will be closed using sutures or surgical staples and a sterile bandage or dressing will be applied over the incision site. Pictures of the procedure. The first picture is the head positioned with a device that will help the head stay stable during the procedure. The second picture is the brain exposed during the procedure. However, in this picture, a large portion of the skull is removed. The third picture is the bone flap being removed. As you can see from this picture, a small portion of the skull is removed. The fourth picture is an incision that is stapled. After the procedure at the hospital. Immediately after the procedure, the patient will be admitted into the ICU or intensive care unit. After the patient regains consciousness, the patient will be evaluated for any new symptoms, strength, balance, and mobility. The patient is required to stay in the hospital for 3 to 8 days after the procedure. After a few days in the ICU, the patient will be sent to physical therapy to regain mobility and strength. After the procedure at home. After 3 to 8 days, the patient will be sent home with a device that helps breathing and helps reduce the risk of pneumonia after the surgery. The patient will be provided with at-home care in which a nurse or physical therapist goes to the patient home to help them with daily activities and exercises that will help them regain mobility. Phases of rehab. There are a total of 5 phases of rehab. Phase 1 is from week 2 to 10 and will begin with seated exercises such as shifting weight from side to side, finger opposition, and ball squeezes. Phase 2 is from week 11 to 20. That will be mainly focusing on seated exercise and maybe some standing exercises, such as sit to stand with clasped hands, seated march, and toe raises. Phase 3 is from week 21 to 35, and it will be standing and balance exercises such as heel raises, walking with a walker, and marching in place. Phase 4 is from week 36 to 40, with balance and strength exercises, such as walking with a cane if the patient is comfortable, raising a dumbbell straight out, and rotating the body side to side while being seated. Phase 5 is from week 41 to 45 and will consist of all strengthening exercises such as learning to pick up things from the floor, walking without a cane, and maybe even lightly jogging, and leg adduction with the chair. The patient will be asked to continue the exercises at home even after being cleared by a physical therapist. Summary. A craniectomy is a neurosurgical procedure where a portion of the brain is removed to allow a swelling brain to have room. A person needs a craniectomy due to traumatic brain injury or other conditions. There is a total of 5 phases of rehab that the patient follows to move towards a full recovery. Thank you for listening, and I hope you enjoyed my presentation.